Good morning. My name is Dr. Doug Willen. This is Saturday morning, March 21st, and this is my New York City update. I'm a chiropractor and clinical nutritionist. I practice in New York City in the middle of Manhattan, but I live in Brooklyn, and I'm making this video today from Brooklyn. A lot of stuff's going on. New York City is not waiting any longer for something to happen. It's happening already. It's happening now. I went into work yesterday, and typically a typically a Friday morning, or Friday is our busiest day of the week. We see well over 30 to 40 people sometimes on a Friday, and we had about 7 or 8 people yesterday. And we schedule them one at a time so that not everybody would be in at the same time to have social distancing. The people that did come in were people that were in a lot of pain, people that have horrible sciatic pain or certain nerve problems or joint problems where they needed to be seen. By the end of the day yesterday, I got an email that my building was shutting down 2 days early because with the New York City pause, which is our shelter in place, being active Sunday night at 8 p.m., which would be tomorrow night at 8 p.m. Friday afternoon yesterday, my building decided that that was going to be their last day. So as I left, it was locked up without any re-entry possibility. I have patients on the schedule for next week. Not a lot, but these are the same people that are in pain that I seem to be able to help, at least in this time period. Plus, they don't want to go into the hospital, perhaps, if I can help them to stay away from the overload on the hospital, as well as they don't want to be infected by going to a hospital. Who knows? That's how people are thinking these days. So we're in a lot of we're in it. So one of the things that I did the last 2 days is I took my temperature, and this is my temperature today. Let's see, 97.5 degrees Fahrenheit. I put up on the screen, normal for Fahrenheit is 97.7 to 99.5. Celsius is 36.5 to 37.5. Now, I know a lot of people think 98.6 is the what it should be in Fahrenheit, or 37 degrees in Celsius is what it should be. But humans are all different and we vary, and that's why it's good to take your temperature, especially at this time, and know what your personal average is. Now, my personal average is low. I'm not even in the normal range, so that if I become 1.5 degrees higher than what I was this morning, that would put me at 99 degrees, which a lot of people wouldn't feel is a fever. But for me, that would be a fever because it's only zero point 0.4 higher than what's thought to be the average. Except for me, it's 1.5 degrees higher. So with Fahrenheit, know your average, know what your true personal average is. And in Fahrenheit, 1.5 degrees higher than that might be a fever. And in Celsius, 1 degree higher, you're in a fever. And that might just be a good just a way to screen yourself or have your loved ones check them too. So we're in a lot of trouble right now. New York City went 10x from Monday to yesterday in reported cases, just in New York City. So, but when I did a video yesterday, we were at 3,600 cases. The day before, we were at 1,871. So now, as of yesterday, and I'm sure it'll be more today, Saturday, and I might do another video later in the day if something changes, we're already at 5,683 cases and 43 deaths. Let me move the screen to another slide. Governor Cuomo said that we're now in a pause. So like how San Francisco has a shelter in place, we didn't really want to call it that doesn't matter what you call it, but what's happening is they're ordering all non-essential businesses to keep workers at home. What I'm curious about is what I will be called. I don't think of myself as a medical doctor, but I do have patients that rely on me. So we'll see what happens. I imagine I'll have to stay home too, but I'm ready to serve if I need to. Here's an interesting stat that New York State with 6% of the total US population now accounts for around half of the cases. So New York City is being hit hard, and a lot of obvious reasons. One is that we're such a melting pot of different travelers and cultures and people that travel internationally. We're also like a little petri dish in this little tiny island that we call Manhattan and the surrounding area, where we have millions of people clustered into an area. It's a very tightly packed population. So we're already overflowing, or we're overburdened already. It didn't have to wait long. Here are some of the highlights. Again, I said that Governor Cuomo says Sunday at 8 p.m. we're kind of shutting down. So that's our shutdown time. For people under 70 years old, we're going to be allowed to be outside to get simple activities done, like going to the groceries, going to the doctors. You can exercise, walk, but try to stay 6 feet from another person. Mass transit, trains, and or we call them subways and buses, or Long Island Railroad trains will be open, but they want us to limit that. Non-essential gatherings for any reason are banned, so we're not going to see outdoor weddings and things like that. It's not a good time to create one like a big barbecue or anything like that. For people over 70, they definitely have compromised immune systems. We're worried about them if they have compromised immune systems. I'm not saying people over 70 all have compromising immune systems, but someone over 70 with a compromising immune system, any underlying illness, should stay in. But if they can't, they should wear masks and be very careful to be around places with tightly packed people, and try to look for that 6-foot radius whenever possible. People are being encouraged to work at home. Essential businesses. So here's what's thought to be essential right now: grocers, grocers and restaurants that can stay open. Healthcare providers, pharmacies, gas stations, convenience stores, banks, hardware stores, laundromats, childcare providers, and you could see the list and read it. So I don't know where my specific practice will fit in, as I said, but I'm waiting to find out. Businesses that violate this order will be fined, so they're taking that kind of seriously, being taken. New York hospitals are already overwhelmed. I just heard something on the kind of a podcast this morning that said that the ICU units in New York City are more than half filled with coronavirus cases, not just their normal ICU stuff. And here we go. We're low on ventilators. There's being a call for any industries that could build ventilators or make hospital masks and retool their shops. This would be a big help. Doctors in a Kings County hospital here in Brooklyn, where I live, or nearby where I live, don't even have enough masks. So picture this, like a surgeon going into surgery with a dirty mask or no mask, or a mask that's so worn out it's hanging off their face. That's where we are already. We don't have to wait any longer. Here's something that I thought was interesting, because I've never seen this before, but it says that the buses will be free next week. So we'll see if that happens. Something like that. I just can't even imagine it. I'm going to try to report as much as I can. As long as I'm staying home, I'm going to do this. If you like this, please subscribe. This is what the alert button looks like. Let's stay in touch. Leave a comment. Let me know what you're doing. These type of photographs, it would be great if someone sent me one from where they live. Shoot it landscape, shoot it for at least 30 seconds, and hold the camera very still. Don't be in it yourself. If you want to send me another one with you in it, that's fine, but the one for a backdrop has to be shot in landscape on your smartphone, just like this. Hold it still for 30 seconds. Tell me where it's from. Maybe I'll put it in. All right. Thank you.